collaborators, and a warm welcome to this module. Today, we'll be tackling the Introduction into the Health Data Analysis course. Over the next few hours, we're going to embark on a practical journey. Imagine yourselves stepping into the role of a newly appointed laboratory director at a significant research consortium. This isn't just a theoretical exercise. The skills we develop today are directly applicable to many of our roles. Why this matters. In healthcare and clinical research, data is paramount. Errors in data, whether they occur before a sample is even analyzed, which are pre-analytical errors, or after the results are generated, which is post-analytical errors, aren't just abstract numbers. They can have real-world consequences, potentially impacting patient safety, compromising the integrity of a clinical trial, causing significant delays, and leading to increased operational costs. Data clarification forms, or DCFs, are standard tools used to flag and resolve these data issues. However, a high volume of DCFs or DCFs that take too long to resolve often points to a deeper and systematic problem that need our attention. So let's set the stage. You are a newly appointed lab director at Lehle Research Consortium. This consortium is a very busy place, overseeing more than 15 active clinical trials. Recently, internal audits and sponsor feedback have raised some red flags. There's a noticeable increase in DCFs, highlighting issues with both pre-analytical, so before, like when they're collecting the sample, and post-analytical, which is data entry reporting processes. The time it takes to resolve these DCFs is also climbing. The average resolution time or turnaround time, or TAT, is currently around 14 days, which is significantly higher than the target, which should be 72 hours. Naturally, this has led to some complaints from study sponsors regarding the data quality and timelines. Your mission, should you choose to accept it, and you have, is to dive into DCF data. Your goal is to analyze this data to identify root causes of these errors and delays, pinpoint specific problem areas, are certain studies or particular reference labs struggling more than others, and then propose concrete data-driven actions to improve performance. Ultimately, aim to reduce the overall DCF turnaround time by 30% within the next 6 months. So by doing this project, this is what you'll learn. You'll learn to understand common data quality issues in lab settings. You will use Power BI and visuals and filters to analyze performance. You'll also learn how to clean and prepare data for analysis using Excel, create interactive reports in Power BI to visualize your findings, and import and create basic DAX measures in Power BI, and develop data-driven recommendations, and also to practice communicating your findings to stakeholders. So the materials you'll need is a computer with Microsoft Excel and Power BI installed, the provided datasets, which you'll find in Google Classrooms, and then the instructions that will follow in this presentation, and then a software to create a PowerPoint presentation. You can use PowerPoint or Google Slides. And all you need is basic computer literacy and just be familiar with Excel. So this course is divided into different phases. The first phase, we will be doing data cleaning, and data preparation. Phase one is all about laying a solid foundation. Before we can even think about drawing meaningful conclusions, we need to ensure our data is clean, accurate, and consistently formatted. There's a common saying in data analysis: garbage in, garbage out. If we analyze messy data, we'll get messy and unreliable results. Our objective here is to standardize entries, calculate some metrics that aren't explicitly in the raw data, and handle any inconsistencies or missing information. So you will inspect your data for any errors. You will scroll through, familiarize yourself with the different columns, and see if there's any typos or missing information. Then step two would have been to standardize your DCF reasons or DCF category. This has already been done for you. Then the next step will be to calculate your turnaround time. Now you can do this in Excel, but you can also do it in Power BI. But for this course, we'll do it in Excel and then import that clean version of the data into Power BI. Then in Power BI, we will categorize the error phase or the root cause. Are we having more DCFs from specimen collection, which is under pre-analytical errors, or is it under post-analytical stage? Finally, you will review and save your cleaned dataset, which will be ready for Power BI. Phase two is the data analysis part. So this is where you will be importing your data into Power BI and then creating analytical measures, so charts, scatter plots, all that, everything that you need to visualize your data. So you will open Power BI, get your data, select your sheet containing your cleaned data. Then you will create basic measures such as the total number of DCFs and your average turnaround time. Step three, you are going to explore and analyze firstly your study performance. So this is the first visual that you will create. Then you will explore and analyze your reference labs. Then you will explore and analyze your turnaround time. And then your root cause identification or your error phase. Then phase three will be your visualization or dashboard creation. So this is where you customize your dashboard. You don't have to use the same exact colors. I used a palette that is more purple, but you can use any color to your liking. Just make sure that you use good colors that are contrasting so you can actually see what's happening in your dashboard. Then you will build your report. Be creative with it. Then you will add interactivity. So I'll show you how to do this to add interactivity. So if you want to analyze data from a specific study or from a specific lab, you can do that in the dashboard. Then phase four is your recommendations and reporting. So this phase is all about synthesizing your findings from the Power BI analysis into actionable recommendations and then practice communicating. The goal of analysis is to drive change and improvement. So you will review your findings from your Power BI dashboard and formulate 3 to 5 specific, measurable and achievable, relevant and time-bound recommendations. So you should consider which specific studies or labs need attention, which specific procedures seem problematic based on the top standardized reason categories? Do we have a problem with sample collection? Do we have a problem with releasing results? Do we have a problem with visit codes or participant initials? Like, where is this problem and where is it prevalent? Then you will also review what could improve the turnaround time based on the average TAT analysis per lab or per study. Step 2, you're outlining now a stakeholder presentation. So now you're getting ready to present your data. This is where you create your presentation. So you need to cover in this presentation, 1, the problem. Secondly, your key findings, referencing insights from your Power BI visuals. You might even take a screenshot of those visuals and then include your recommendations and then outline your expected impact. And remember, your goal is to reduce TAT by 30%. Step 3 is to practice your stakeholder communication. And then, if you're willing to, you can just be prepared to briefly discuss your findings and defend your analysis, if asked, using evidence directly from your Power BI report. So I will share the reflection of this module with you once you have completed all of your tasks. So at the end, you will be submitting 1, a cleaned Excel file, number 2, a Power BI file, and your slides containing your findings, recommendations, presentation outline, and the draft of the email that you'll be sending to your stakeholders. It's optional, but there are instructions on how to submit that. And these are the skills you would have developed at the end of this course. Number 1, data cleaning techniques, then formula creation, standardizing inconsistent data, date calculations, categorical classification, data import and prep, DAX measure creation, visualization design, interactive filtering, dashboard creation, root cause analysis, performance evaluation, trend identification, data-driven decision making, and stakeholder communication. The skills you would have developed in this course directly translate into real-world healthcare settings where data-driven quality improvement is essential. Clinical laboratories, research institutions, and healthcare facilities all rely on these analytical approaches to identify issues and implement solutions and monitor progress. By mastering these tools and techniques, you're better equipped to contribute to improved patient care, operational efficiency, and regulatory compliance in your health career. So get ready now to actually create these documents, import them, create a beautiful dashboard, and then a presentation, and learn to communicate your findings. So if you're ready, I'm ready. Let's go.